Hello, madam. Hello, everyone. First of all, let me introduce myself. My name is Afrian Anugrah, and I am the group leader for Group 12. Today, me and my group will be presenting our assignment with title Healthcare and Pharmaceutical Supply Chains. Before we begin, I would like to introduce my teammates. We have Wei Tong here, Ong Zi Yang, as well as Mazen. We will each present different parts of the assignment. Okay, without further ado, let's get started. First, I would like to invite Wei Tong to begin the presentation with part 1. Thank you.
Hello, my name is Wei Tong. Today I will be presenting part 1, Evaluation of Supply Chains Threat. So for the first part, supply chain cybersecurity as a critical business concern. Modern healthcare and pharmaceutical supply chain heavily rely on technologies such as ERP system, cloud management platform, IoT device, and automated manufacturing solutions. ERP stands for Enterprise Resource Planning System. While those technology boost operational efficiency, they simultaneously introduce significant cybersecurity risks. Pharmaceutical companies are primarily targets for cybercriminals because they possess valuable intellectual property, sensitive research data, and patient information. There are severe consequences. Cyber attack in this sector can directly disrupt production line, compromise sensitive data integrity, and threaten patient safety. Business resilience. Cybersecurity is deemed a core requirement to ensure the baseline resilience and reliability of pharmaceutical supply chain. Next. Let's talk about the comprehensive evaluation of business supply chain risks. First, vendor and third party, such as contract research organization, specialized raw material provider, external IT consultants, and third-party distributions. The critical vulnerability, such as heavy reliance on external partner data, structure, and weak access control implementation, potentially exposing credentials in the vendor network. Besides that, system and architecture, such as operational technology like automated manufacturing, commercial off-the-shelf software, and core enterprise architecture. Critical vulnerabilities such as unpatched legacy system software and hardware alongside software that fails to strictly align with the security standards. Next will be the logistic and distribution, IoT condition monitoring device, specialized third-party logistic, and product serialization line. The vulnerability, interconnected distribution nodes that expose corporate ERP endpoint, tempering risk with the serialized tracking network, and vulnerable endpoint configurations on the IoT data logging module. Next, we will talk about the critical vulnerability assessment. The primary risk is third-party vendor. Exposed is identified as the single largest risk to the supply chain. Secondary risk and the third risk would be legacy system and insecure operational technology present in several vulnerabilities. Those structural gaps make it significantly easier for hackers to gain unauthorized access, deploy ransomware, and completely halt manufacturing and distribution pipelines. Last, we'll talk about the risk level justification. It reads as high risk due to surging attack. Early 2026 data metric shows a notable spike in sector-specific cyber attacks and healthcare data breaches. It will cause the ripple effect. The industry rely on massive, complex multi-trade networks of independent provider. A breach at a single minor vendor can cause a ripple effect, exposing multi-billion-dollar asset across the entire ecosystem. Last, the human element. Internal vulnerability compound external threats. Human error is responsible for the data breach, and the insider credentials are actively being sold on the dark web. That's all for me. Thank you.
Okay, now I will present the major cybersecurity threats affecting healthcare and pharmaceutical supply chains. Based on our evaluation, we identified three major threats. The first threat is third-party ransomware attacks. This is considered the most critical because many pharmaceutical companies depend heavily on suppliers, logistic companies, and cloud service providers. If one supplier is compromised by ransomware, the attack can spread across the supply chain, disrupting production and delaying medicine distribution. The second threat is enterprise software exploit. Attackers exploit vulnerabilities in enterprise application, file transfer system, or security gateway to gain unauthorized access to sensitive business data and intellectual property. Finally, the third threat is embedded operational technology or OT. Tampering. In this attack, cybercriminals target industrial control devices or embedded systems used in manufacturing. Although it is less common, it can directly interrupt pharmaceutical production. After identifying these threats, we compare them using several evaluation criteria. This is a table summarizes our companies of the three threats. We evaluate each threat using three criteria. The first criterion is impact, which measure how severe the damage will be. The second is likelihood, which estimates how frequently the threat may occur. The last criterion is detectability, which evaluates how easily the attack can be identified before causing damage. First threat, third-party transfer. The impact rating is critical, and the likelihood rating is high. Detectability rating is medium, and overall it's one most severe. The second threat is enterprise software exploits. The impact rating is high, and for the likelihood rating is medium. Detectability rating is low, so this is the second one. And threat, embedded OT tampering. The impact rating is high, likelihood rating is low, detectability rating is low. So this is the third least severe. So based on this criteria, third-party ransomware received the highest ranking because it combines the highest impact with highest likelihood. Next, I will explain why these threats were ranked in this order using real industry example. So the first ranked threat is third-party ransomware. We rank it first because it can immediately stop production, lock important business system, and steal confidential data through double extortion techniques. Since pharmaceutical companies rely on many external vendors, one compromised supplier can affect the entire supply chains. The second ranked threat is enterprise software exploit. This attacks target software vulnerabilities in enterprise systems or gateways, allowing attackers to access sensitive research data, financial information, and business operation. The third ranked threat is embedded operational technology tampering. Although this attack can disrupt manufacturing equipment directly, it requires specialized knowledge and occurs less frequently than ransomware or software exploitation. Therefore, it is ranked third despite having a high operational impact. Overall, these rankings help organizations prioritize cybersecurity investment based on both business impact and attack probability. Next, we move on to key takeaways. To conclude, healthcare and pharmaceutical supply chains face multiple cybersecurity threats. Among them, third-party ransomware represent the greatest risk because it can affect multiple organizations simultaneously and disrupt critical medicine production. Although software exploit and OT tampering are also significant threats, they occur less frequent or require more specialized attack technique. Therefore, organizations should prioritize supplier security, continuous monitoring, and stronger protection of enterprise system to improve the resilience of the supply chains. Okay, that's all for me. Thank you.
Hi, my name is Ong Zi Yang. So today I'm going to talk about evolution of cybersecurity framework. So I'll be comparing the two security framework. The first one is INST cybersecurity framework, and another one is ISO IEC 27001. So for the NIST security framework, its strength is flexible and easy to adapt. It focuses on the risk management. It supports continuous monitoring, and it helps organizations detect and respond to cyber threat quickly. But its weakness is it does not provide official certification, and different organizations may implement it differently, and small company may lack the skill or budget to use it efficiently. For the ISO IEC 27001 part, its strengths are in it has international certification standard, and it improves security policy and documentation, and it also increase customer trust and support compliance. But its weakness are it is more expensive and take more time to implement, and it focus more on management than technical security, and the organization need more resource to maintain the certification. So to compare about these two framework, I NIST have better for risk management, more flexible, and low implemented cost and stronger technical guidance. But for ISO, it provides certification, have strong governance and documentation, but it higher implemented cost and less focus on real-time threat monitoring. So, recommendation framework for the healthcare and pharmaceutical supply chain is NIST's cybersecurity framework, because the pharmaceutical company work with many supplier and third parties, and NIST cybersecurity framework help to identify cyber risks, monitor system continuously, detect attack early, and respond and recover quickly. And these features are important because cybersecurity can delay the production and delivery of the life-saving medicine. So let's talk about the vendor risk management. So both of the framework helps the supplier risk well, but for the NIST cybersecurity framework, it performs risk assessment, monitoring supplier activity, and support incident response better than ISO. For the ISO, it uses security policy, security contract, and supplier audit and compliance check. And ISO is focused more on compliance, while NIST cybersecurity framework focus more on real-time cybersecurity threats. So about the gap identified and recommendation about the two framework, it is most difficult to monitor overseas vendors, and vendor risk scoring is not centralized. IoT and OT devices are difficult to secure. So to improve the security, the recommendation are continuous monitoring using software bills of material or SBOM, or third-party penetration testing, or using zero trust access, sharing threat intelligence, or annual cybersecurity assessment for the supplier. So about the threat intelligence and framework integration, it is important because it helps organizations to detect news vulnerability, identify compromised account, track attacker activity, improve incident response, and this allow organization to respond faster and reduce the impact of the cybersecurity. So that's all for the part two. Thank you.
Good evening. My name is Mazen Ashraf Emam Khalil, and my student ID is 243UC246C2. And I'll be presenting part 3, which is evaluation of mitigation strategies for cybersecurity risks in healthcare and pharmaceutical supply chain. So, this section focuses on two main areas. First is the best practices to secure the supply chain, and secondly is vendor and third-party risks in management strategies. For this part, I identified 5 important cybersecurity best practices. The first is vendor risk assessment, which helps identify risk suppliers before they access critical systems. Secondly is the zero trust access control, where vendors only receive the minimum access required. The third is vulnerability management, which reduces exposure from known vulnerabilities, especially when legacy and IoT systems. The fourth is SPOM and secure procurement, which improves software transparency. And lastly is backup and incident response planning, which supports recovery from ransomware. How the controls work together. These 5 measurements are strongest when they're applied together as one layered strategy. So, the first is the organization should assess its suppliers before giving them access. This means ranking vendors based on their risk level, especially if they handle sensitive data, production systems, or logistics platforms. Second, access must be controlled using zero trust. Vendors should only receive the minimum permissions needed for their work, and their access should continuously verified. Third, the organization needs to harden its system through patching, segmentation, and monitoring. This is important because pharmaceutical supply chain may use legacy system, IoT devices, and manufacturing systems that cannot always be updated quickly. And fourth, SPOM gives better visibility into third-party software components. This helps the organization know what software is being used and whether any component has known vulnerabilities. Finally, backup and incident response planning help the organization recover if an attack happens, especially in ransomware cases. So the main point of this slide is that no single control is enough. Strong mitigation strategy needs supplier assessment, access control, system protection, software visibility, and recovery planning working together. For vendor and third-party risk management, I compared 4 approaches. Vendor audits provide detailed evidence of supplier security controls, but they can be expensive and only periodic. Certification shows that vendors follow recognized security standards, but they do not guarantee real-time security. Continuous monitoring detects vendor risk changes faster, but it needs tools, cost, and skilled staff. Security controls create clear responsibility, but only if they are enforced and reviewed. Recommended strategy. The best strategy is combined approach. Continuous monitoring should be the main method because supply chain risks can change quickly. However, it should be supported by audits, certifications, security contracts, and risk scoring. So this gives organization real-time visibility as well as former supplier accountability. So in conclusion, the best mitigation strategy combines preventive controls, access control, monitoring, and recovery planning. So that's all for my slides. Thank you.